Hi everyone, welcome to our condition of the week. This week's condition is ear infections, something that we see very commonly in the office with a lot of the infants and young children, but it often is dealt with adults as well. Ear infections tend to be a problem where the child's eustachian tube is very horizontal as opposed to angling down in an adult. So it doesn't seem to drain as well in a child as with an adult. We also have a muscle called the tensor veli palatini muscle that allows us to open up the end of the eustachian tube to get it to start to drain. Or the eustachian tube is really how we equalize the pressure when we go up in a plane or when we are going up into a mountain. You'll swallow to try to get that eustachian tube to open up, and then you can equalize the pressure behind the eardrum. When the fluid is building up because of the infection behind the eardrum, if that tube is not patent, then the child starts to develop the pain and the earache. The solutions for them out there may be, putting tubes in their ears, which to me is kind of it's a dangerous thing to be a very delicate membrane that you're putting a tube through that can lead to scarring after the tube is removed. The child often responds very positively to something we call endonasal technique, where we put a glove on our hand and just kind of go in and try to go down the back of the throat and open up the eustachian tube physically to allow it to start to drain. And this works in adults as well. We also adjust the child. We do our adjustments to try to get the immune system working better. The nerves that control the ear and the immune system are usually coming from that upper cervical part of the spine, so that's the area we're going to check. The adjustments will often help the child to recover very, very quickly. There's been studies done on 200 children that were under chiropractic care and 200 children that were actually in the under medical care, and the stats weren't even close. There was only a 17% rate of ear infections in the children under chiropractic care, as opposed to the kids in medical care that was 67%. Dr. Ron Perot looked at the immune system. He looked at people that were under regular chiropractic care, as well as people that were in the general population and then people that had really serious illnesses. And he was chief of cancer prevention research down at New York. What he found was that the immunocompetence of people under regular care was actually 400% better than people that were actually having serious chronic illnesses like cancer, and it was 200% better than people in the general population. So there's lots of research out there to support that staying under chiropractic care. The immune system's an organ, just like your heart and your lungs, so better neurology to that organ is going to actually certainly allow it to function better. Now, most people, when the child has an ear infection, will go to the doctor and they'll expect to get an antibiotic, but even the Journal of the American Medical Association states that they should wait 90 days when the child has their first ear infection, and possibly even another 90 days, because what happens is the child will take the antibiotic and it kind of blasts all of the bacteria there, not even just the bad ones, but the healthy bacteria, and it kind of leaves it a barren wasteland for repeat infections. So the stats are that a child that takes an antibiotic is 4 to 5 times more likely to have repeat infections as opposed to someone who just deals with it naturally, allows the body to build up its natural immunity. So that's what we hope to do. By this video, I hope I've given you some natural solutions, some natural options, parents, as opposed to taking the chance of penetrating the eardrum with the tubes or taking the antibiotic that is really going to deplete their own immune system and not allow it to work. We hope you've got some other options and you'll pass this on to your family and friends. Please share on your social media so people can get this message. Hope you'll tune in next week when we have another condition of the week, and thank you very much for watching.